What about penis size? I heard you did some pretty landmark research which suggests that the length of a man's penis is increasing decade over decade in terms of men that are being born and boys that are going through puberty.
Yeah, so this study also got a lot of attention. So similar to how we've tracked testosterone levels over time or sperm counts over time, for different reasons, investigators have measured penile length, to kind of give normative data across different populations to understand how different surgeries or conditions may affect penile length. So, we looked at, all the studies, and there were dozens. And so we kind of pooled all that together. And this was tens of thousands of men, and just looked at sort of average penile length over time. And so, again, based on some of the data on semen quality, we would have expected things to get shorter over time. And also because we're more obese now, the way that penises are measured is you kind of pull the penis on stretch and use a tape measure or some sort of ruler or measuring device. So if there's kind of more gut, more fat, in theory, length should be a little bit shorter now than it used to be. But it turns out, at least when you measure erect penile length, that penises are longer now than they used to be. And so over the past 30 years or so, they've probably gone up about 25%.
Why?
I mean, it's a good question. I think one hypothesis we had, kind of looking at sort of different endocrine, abnormalities and changes in puberty, is that if men go through puberty or boys go through puberty earlier, that tends to correlate with longer penis length. And so if we are shifting puberty, again, through these different environmental exposures, maybe that is leading to, changes in genital development. And this may be one of the consequences of it.
Does this have any upstream implications for sex?
I think that, well, the numbers we're talking about shouldn't be, kind of enough to make a big difference. People, as this study came out, we talked about, very enterprising patients kind of reaching out, sending emails. Some people hypothesized that this was kind of natural selection. So it's hard to know. But again, it's a very short period of time. So it's hard to believe that there's, that's kind of at play.
Do you have many people that come into your practice that are struggling with erectile dysfunction?
Yeah, so that's another very common condition we see. If you look at men over the age of 40, over half have some trouble with erection. So very, very common. Hundreds of millions of men all over the world are afflicted.
We don't talk about this much. What is the cause of this? And are you seeing it increase over time, the prevalence of erectile dysfunction?
I mean, I think the rates are going up. And I think, the risk factors, are the same risk, largely the same risk factors that affect heart disease. So, diabetes, obesity, high blood pressure, high cholesterol. Minority of these conditions can be caused by low testosterone. Sometimes the outcomes of, surgical treatment for pelvic cancers as well. But by and large, it's vascular. It's a blood flow issue.
Because I used to think it was more of like a hormonal thing or a psychology thing,
Mm-hmm.
Sexual anxiety or some kind of, change to our testosterone levels is causing us to struggle with getting erections now. But you're saying it's about...
So I think, psychogenic used to be thought of, like you're saying, as the kind of the primary etiology. And maybe for some, populations, it could be a little bit more common, but generally for most men, sort of all comers, it's going to be a blood flow issue, a vascular, organic cause.
And how would you go about treating erectile dysfunction?
So there's a lot we can do. We do want to, kind of reverse anything that we can, kind of understand where the man's coming from, find out if there's, new relationship or other kind of factors. For men, like, you're suggesting that we do kind of suspect a psychogenic component, work with sex therapists as well. But for other men, I always like to be very positive. It's like to say, as long as you have a penis, we can always make it hard. So there's a lot that we can do. So usually we start with pills, like Viagra, Cialis.
Does that work for people?
It works probably 60 to 70% of the time. So that does work well. Even for men with a psychogenic cause, sometimes it can kind of help reset the system a little bit, convince them and their body that everything is working well.
Like a placebo effect.
Well, I think to some extent, but even more than that, because it does work. It does help. And then I think once they kind of regain that confidence, if there was some sort of traumatic event, traumatic relationship, it can help improve things. Pills aren't enough, or they don't like those, or they have side effects from those. There's other therapies. So there's medicines you can actually put in the tip of the penis, like a gel or a suppository. We can teach men to give themselves injections in the penis.
Oh, I just got a shiver down my body.
There's certainly a kind of a psychological sort of fear of that, but it does work well. Probably works 80 to 90% of the time. There is something called a vacuum erection device. So it's like a plastic cylinder you put over the penis. It sucks blood into the penis, kind of treats it like a balloon, and then you put a band at the base to trap blood inside. And there's even surgeries we can do to put a device inside the penis. So whenever a man wants to be hard, he can be hard.
I didn't know there was surgery you could do.
There's a surgery.
What does that do? It puts a...
So there's two main flavors of it. There's or forms, maybe that's a better term. There's one called a malleable, so it's bendable. So it kind of puts this sort of bendable metal. It's a metal core with sort of a plastic kind of covering. So when they don't want to have sex, you bend it down. When you're ready for sex, you bend it up. Or there's inflatable versions. So whenever you're ready for sex, there's basically a pump that goes in the scrotum, and you just pump it up. It moves fluid into the cylinders, and you'll get a rigid erection.
Is that increasing in popularity?
I think, that it's made by a few manufacturers in the U.S. or in the world, so I think the data is not as freely available. I mean, in my practice, I've seen more and more of it. We're seeing more patients come in. I also say that, my practice is getting a little bit more mature with time as I get older, and so naturally, more patients kind of hear about these different things. But it does work well. I always say it's a self-selected population, right? We don't hold men down and force them to get it, but generally they're very happy. Probably 90% of men are very happy. They'd recommend it to their friends. Partners very happy, recommend it to other couples.
And you press a button and you get you can...
It's a pump right now. They are working actually on either a fob or like a phone app that'll kind of automatically inflate it to make it a little easier for patients.
I had no idea. It sounds like sci-fi or something. It sounds like it's it sounds like something you might see on like a YouTube video that people are working on in like 20, 30 years time. But to know that men have that installed now is amazing.
Yeah. It's very common. The youngest patient I put it in is about 20. The oldest is in his 80s.
Is it seen as like a last option in that menu of options that you presented there, where like the first option is probably Viagra, and in terms of popularity, is it a last port of call?
I think for a lot of men, it's the most aggressive, but some men don't want to do like you had a reaction to the injection. I think that's a very common reaction. There are certainly some advantages to it compared to others. For Viagra, for example, even though it's obviously the easiest, it's a pill, there's some side effects with it. And there's also, a lag time, right? You have to take the pill, wait an hour, wait 30 minutes, something like that. Whereas this, the penile prosthesis, if you just pump it up, it's ready to go in seconds.